Welcome to our tutorial on general pharmacology. In this video, I'm taking you through how drugs interact with our bodies from the moment they enter to the way they leave. So, let's dive right into this fascinating journey. Pharmacology is the scientific study of drugs and their effects on living organisms. There are two big branches you need to know. First, pharmacokinetics, what the body does to the drug. Think of ADME absorption, distribution, metabolism, and excretion. Second, pharmacodynamics, which is all about what the drug does to the body. Simple, right? Now let's talk about how drugs actually get into your system. There are several routes. Starting with enteral routes, these involve the digestive tract. Oral is the most common. You swallow a pill, it dissolves in your stomach and gets absorbed. There's also sublingual. You place a tablet under your tongue, and it dissolves right there for fast absorption. And rectal, sometimes drugs are given as suppositories, especially when oral isn't possible. Next, parenteral routes, these bypass the digestive tract. Intravenous or IV is direct into the vein. You get immediate effect. Intramuscular or IM means the drug is injected into the muscle, where it's absorbed a bit slower. Subcutaneous goes just under the skin. There are other routes too, like inhalation for asthma medicines or transdermal patches for slow, steady absorption. Quick quiz: which route bypasses first-pass metabolism? The answer: IV, sublingual, and rectal can bypass it, depending on the drug. Now, how do drugs get absorbed? They have to cross cell membranes. Passive diffusion is the most common. Drugs move from areas of high concentration to low concentration. Filtration lets small molecules pass through pores. Some drugs need specialized transport using carrier proteins. Absorption depends on a few things. Lipid-soluble drugs are absorbed faster. The pH of the environment affects how much of the drug is ionized. And the bigger the surface area, the faster the absorption. Once absorbed, drugs distribute throughout your body. The blood-brain barrier protects your brain and only allows certain drugs through. Plasma protein binding means some drugs hitch a ride on proteins in your blood. And storage depots like fat cells can soak up drugs and release them later. Next up is metabolism and excretion. Most drugs are metabolized in your liver. Phase 1 reactions include oxidation and reduction. Phase 2 adds something to the drug like conjugation to make it easier to excrete. Drugs are mostly excreted by your kidneys, but lungs, bile, and even sweat can play a role. So, how do drugs actually work? Most interact with receptors. Think of it like a lock and key. Others inhibit enzymes, blocking chemical reactions. And some act physically or chemically, like antacids neutralizing stomach acid. Remember, pharmacology is all about how drugs affect the body and how your body handles drugs. Administration routes matter, and every step from absorption to excretion is important. Thanks for learning with me today. For more tutorials, subscribe to the channel.